I'm Dr. Marta Vázquez-Ortiz, and I'm the program lead for the Allergy MSc. And this is the little agenda for today. So we're just going to go around, do a few introductions, and then I'm going to be talking about the Allergy Postgraduate program, a very brief note on the clinical services linked to Imperial and feeding into the allergy program. After that, we're going to hear the students' experience, and we're very lucky to have Dr. Nina Atchert, who's a pediatric allergy consultant in Bonn, in Germany, who finished the MSc with us a couple of years ago, and Dr. Hannah Peters, who's a GP with an interest in allergy based in London, UK, who's in the first year of the program with us. So they will be sharing your experience with us. And after that, we might have Professor Mo Samchi joining us to talk about the allergy and asthma research at Imperial. He's just back from the EACI conference where, he's sort of, kind of very high up in the senior sort of leadership of EACI. So I'm not sure if he's going to manage to make it on time. Otherwise, I will just give a very brief overview of the different sort of research topics that our main focus at Imperial. And after that, there will be time for you to ask questions. So for that, please use the chat, and we'll be picking questions from the chat. We have my colleague, Tamsin Moala, who's the program administrator of the allergy program, and see if she spots any sort of very sort of admin type questions where a link might be really helpful. This might be replying sort of straight away in the chat. Okay, so who do we have in the room? So you have me as program lead, we have Nina and Hannah, as I mentioned, two of our students. We have Tamsin, our program administrator, and we might have Professor Mo Samchi joining slightly later. Okay. So I'm going to start talking about the Allergy Postgraduate program, and I've been running the program for the last sort of 10 years, so it feels like a long time. And I guess the bottom line when students join our program is they want to become absolute experts in allergy, and here, so from the experts in every single aspect, they really have that level of expertise for their professional career. So do you want that? So if you want that, you're in the right place. Okay. And why Imperial? We know there are other courses of the programs in other institutions. So, well, Imperial is the top 2 university worldwide, which I think is a very big thing. Okay. And as you can read there, from the president of the college at the time, when that was announced last year, this is a testament to the quality and the commitment of the entire community. And this is not only the faculty, but also our fantastic students. Okay. And I think that sort of applies very much to the allergy program as well. So very sort of outstanding contributions to research from the university. And in terms of allergy, Imperial and sort of the institutions that have led to Imperial have made very, very significant contributions to allergy from the very sort of start of allergy as a specialty, and say the first attempt of oral of inhalant immunotherapy was done where we're based at St. Mary's Hospital over 100 years ago by Noonan Freeman. And then there have been a number of clinicians, clinical academics, researchers at Imperial over the decades, making very outstanding contributions to science and clinical practice, such as Dr. Bill Frankland, first clinical trial in inhalant immunotherapy, first pollen count in the sort of at the top of St. Mary's Hospital, or Professor Barry Kay, who made very significant contributions to our understanding of the pathophysiology of asthma, T2 asthma, that has then paved the way for new treatments such as biologics. And that sort of really sort of has led to a lot of strength in allergy, both clinically and academically at Imperial, and Imperial being, positioned second in the world in terms of allergy research. And we have a center for allergy research at Imperial, the Frankland K Center, that was launched last year, very much aiming at advancing allergy research and education. So that's what allows us to have world-class teaching. So all these world-leading experts that are our module leads that are contributing to research in the different areas of allergy and asthma, and their network of international collaborators that also teach in the program. And that allows us to have a very extensive syllabus covering all different areas of the specialty, and a very proactive, engaging teaching and learning approach with very student-centered, active learning approach, lots of group work, lots of learning by doing. We are a very flexible program. We are part-time, and you can choose from studying in the online stream, so fully online, not coming to London at all, or in the blended stream, where a very significant part is online, but then you have very sort of condensed days of on-campus teaching in London with us. And it's a very international atmosphere, both from the students' perspective as well as from the faculty perspective. And we really like that sort of global approach to allergy, to really understand how allergy presents in different parts of the world and how different factors might impact on how the disease presents and how the disease is managed. And the same applies for asthma as well. So where do our students come from in terms of background? So many of our students are healthcare professionals, but not only. We have biomedical scientists, and we have students with other backgrounds such as epidemiology or industry or entrepreneurs. But in terms of the healthcare professionals, we have allied healthcare professionals with specialist nurses, dietitians, as well as doctors. And within that, we have pediatricians, GPs, but also people coming from kind of specialties that are, say, closely linked to allergy, asthma, and say the diseases that sort of link with allergies, such as dermatology, chest, ENT, anesthetists, etc. Background in terms of countries, so wide range, and you see a big list of countries represented there. And if you want to read a bit about, some of our students' journey, you can go into those links that you can find there. And you will hear more about from students from Nina and Hannah as well. So what about the structure of the program? So the program is structured in 3 years to 3 years. So in the first year, everybody does these 3 modules. So the scientific basis of allergy is all about the immunology and the basic science underpinning allergy and how this relates to the clinical presentation, the diagnostic tests, and the management of the disease. Then the diagnosis of treatment and of allergic disease. This is a very clinical, very practical module. So what is best evidence-based practice, practical skills to apply in clinic, etc. And then the last module in the first year is the cutting edge of allergy, which is all about what's new in research in allergy and asthma, and research skills to help you critically appraise the literature as well as develop your own research projects. And people can exit after that with a postgraduate certificate in allergy, or you can carry on, which is what most of our students do. Probably about 90% of our students continue with us and do the second year modules, which are 5. You see them there. So we really do a deep dive into the different disease areas within allergy and asthma, much more into the specifics, the evidence base of the different aspects, complex presentations, and more advanced diagnostics and therapeutics and complex scenarios. Okay, and there we have in terms of modules, so food hypersensitivity, which is a bigger module, and then 4 smaller modules, so rhinitis, rhinosinusitis, and immunotherapy, asthma and allergic airways disease, allergic skin disease and drug allergy, and pediatric allergy. And again, students can exit at that stage with a postgraduate diploma, or they can carry on with us and do their own research project. And that research project can be done as a standalone element in year 3, or it can be done within the second year alongside these 5 modules. It's a very busy year, but some students opt for that choice. Okay. The research projects can be an imperial project, so a project that we offer, and then you have purely imperial supervisors, and some students choose to do a local project in their own institution with their own supervisors, and then they also get an imperial supervisor as a secondary supervisor for additional support. And research projects can be original research as well as systematic reviews. Okay. So that's that. You can do all of these fully online if you join the online stream, or you can join the blended stream, where a big part of the teaching is done online together with the online stream. So we work as a kind of a single sort of group, but then there are hybrid days where the blended stream people will join on campus and the online stream people will join online on the same day. So it's a hybrid day, and that is 1 or 2 consecutive days, 3 times a year in year 1 and year 2, and the rest is done online. Okay. So when the hybrid days are kind of planned, it's generally at the end of each module, 1 day or 2 consecutive days. So you have the dots there as 1 day or 2 days. Okay, great. So how is the teaching method? So there's a lot of material for you to go through and sort of learn all the ins and outs. And part of that, both for the online and the blended streams, a part of that is what we call asynchronous. So it's a sitting there for you to watch and do in your own time. We launch each module and release pretty much all the asynchronous content for you to access that at your own pace. And within that, you can find recorded content, so lectures, mini lectures, interviews, podcasts, practical demos or simulation training. You can find the reading list for each module, web-based resources, interactive exercises and tasks to do individually or within your group. And then we have this synchronous element, so the live teaching elements, and part of that is online and part of that is hybrid, as I mentioned. And the live is mandatory, so you have to attend, and it's very much for interaction. It's not for, say, didactic teaching in one direction. So it's very much to come and ask questions to the speakers, to the experts, to discuss cases, tricky points, focus discussions. We do workshops, role play, simulation. We do quite a lot of group work where you've done some work with your group, and then you can present or discuss. And there's quite a lot of student-led sessions, so things like journal clubs, book-on debates, poster or oral presentations. And with the blended people on campus, we do hands-on practical sessions as well that the people on the online stream have as interactive exercises online or practical demos online. Okay. So how we run a module, so say the first week of the module, we have the launch webinar, which is a 30-minute webinar where we present the module and we release the content of the module. We give you about 2 weeks to start, getting sort of familiar with the content, and we start with the online half days. So we have a half day a week for a few weeks in a row, and then we end up with the hybrid days. And after that, you usually have about 4 weeks for your assessment for that module, and you're done with that module, and then the next module will come in. Okay. So assessments. So this is for the whole MSc, so it doesn't apply to the first years, let's say, but basically these are all authentic assessments that very much give you the skills to master those things for your own professional career. So you have things like quizzes, writing case reports, running a mock allergy clinic, writing a research grant application, doing a poster presentation or oral presentations of things that you will do in a conference, presenting a complex case as a group, a patient info event where you're the expert, writing a review paper, or writing your MSc thesis that very much follows the structure and the guidance for an original article. So it's very easy then for our students to publish their work if the quality is, say, good enough, for that. But we've had 12 students in the last 3 years publishing their papers in high impact journals in allergy because they really were really good quality. So this is how, say, some of the asynchronous learning materials look like. So this is, say, the overall sort of table reflecting the module content for one of the specific modules, and you access the different recordings and materials with the links, and you can see what tasks you have for each of the sessions if there is one, and you find sort of this kind of interface to access the different materials. Again, we have interactive exercises like sim scenarios, consultations that you can sort of watch and interact, the quizzes related to these, the cases, the interactive diagrams as well, practical demos, virtual tours in the lab, in the research facility, etc. So quite a lot to go through if you want to get it all, okay? This is how the synchronous teaching looks like. So these are online meetings, not very special these days. You have a lot of that in general, right? And this is how the hybrid teaching looks like. So we have students on campus as well as students online, and everybody's like equally important, I would say. And then lots of ways of promoting interaction and getting feedback, as well as at the end of the modules with the, say, official feedback, a very sort of responsive to feedback we try to be. And these are some of the very, say, hands-on practical exercises we do with the blended people. So you see nasal endoscopy, eczema creams, food challenge materials, you see anaphylaxis management, skin prick testing, complex case management, etc. So application deadlines for home students is end of August. Overseas students, if you're applying for the blended stream, deadline is end of July because of visa requirements, but don't leave it last minute because the whole application process takes a while. So just allow a few weeks at least for this. And then if you're an overseas student applying for the online stream, deadline is also end of August. But again, just apply quite a few weeks in advance. Funding opportunities. So we offer our own scholarships. So one 3,000, 3 at 2,000 towards the PG cert fees, and one for people applying for the full MSc covering over 7K towards the MSc fees. So the deadline has been extended, and the deadline is now the 2nd of July. So if you haven't applied, we will encourage you to do so because it's, really nice way of getting some financial support. There was the master scholarships from the Faculty of Medicine, which is very good as well, but that closed back in April. So that's not there anymore. So in terms of fees, I'm not going to go in a lot of detail, but sometimes you get the question because people struggle a bit to make sense of it all. So say this is home fees, MSc, so the full MSc will be 15K, but often what people do, they register, say for PG Cert, they pay the PG Cert fees, then they do the top-up fee towards PG Dep, and then they do the top-up fee towards MSc. So you end up paying the 15K kind of in that way. So that's what most people have done in the past, but it depends on how you register, etc. But just to help you make sense of the information on the website. Career opportunities. So what do our students go and do after being with us? So many of our healthcare professionals go into, say, much more senior and specialized roles. So we have quite a few colleagues who are now consultants leading a team, lead clinician or lead nurse, lead dietitian within the specialist services. We have GPs with a special interest working within the public sector, or quite a few colleagues also do some private work these days, and often they work within an MBT and they have, say, upskilled their multidisciplinary teams and really sort of brought their service to the next level. So a lot of service development happening as a result of a team member joining the allergy program. In terms of research opportunities, some of our students have gone into doing an MD or a PhD after doing the program with us and have become principal investigators in their own institution, or they've gone into sort of nice research job opportunities for career progression, such as lead allergy research nurse or senior research fellow applied for interesting grants, etc., or are doing research within industry as well. So some people have gone to industry again, and they might have roles like clinical research physician or medical advisor or more senior positions within industry. So that's all about sort of the education program. I'm very happy to answer questions at the end. So this is just a tiny snapshot of the clinical services that feed into the allergy masters. So allergies is very much a multi-organ disease, right? So quite a few different specialties have, a very significant role in the MSc. So of course, respiratory medicine with asthma and allergic airway disease, dermatology with atopic eczema, urticaria, contact dermatitis, etc. Gastroenterology, ENT, as well as other specialties as well. For instance, ophthalmology, anaesthetist join and teaching the course as well. And the key sort of hospitals you see there is St Mary's, Brompton, Hammersmith, Chelsea, Charing Cross, all very central in London. So we teach now in South Kensington, which is a very nice location as well. So, it's like very, very, very rich. So this is just a snapshot of, say, what's one of our services contributing to the MSc looks like. So this is the pediatric allergy service at Imperial NHS, mainly based at St Mary's, and also Hammersmith Hospital, and some strong links with Chelsea. So with one of the largest tertiary referral centres in Europe, we are a very multidisciplinary team. Doctors, nurses, dietitians, speech and language psychologists working together in the best interest of children with complex allergies. We have strong links with different specialties, particularly dermatology, gastroenterology, respiratory medicine, ENT, as well as general pediatrics. We see over 6,000 children a year with the whole spectrum of allergic diseases. We have a focus on complex patients, holistic care, and patient education for self-management. We do strong evidence-based practice, and we have a strong focus on translation and research, working very closely with the clinical research facility at Imperial, so recruiting patients for research studies as well as applying research findings back into the clinical service from our own research as well as from anywhere else in the world where things are happening. We are a training center for Greek trainees, for pedology, for SPEED trainees, and we have international fellows pretty much all the time as well. And we are the lead for pedology for Northwest London. So the severe asthma service at the Brompton is really sort of a leading service in Europe and the world on the management of difficult and severe asthma. And this is just to show, how they really encompass, best clinical practice, teasing out what's difficult asthma, where there are modifiable factors that with behavior change in terms of adherence, in terms of environmental control and changes, things can improve. And it's very much a multidisciplinary team working together with the patient and the family in the center, working together with other professionals as well as school, safeguarding, social workers, etc., when needed, to make those patients better. And then the severe asthma cohort and a strong interest in phenotyping and understanding the different endotypes and phenotypes of severe asthma using basic science and molecular markers as well as non-invasive measures to try and, do precision medicine and targeted therapies. And they have a number of clinical trials addressing, say, the use of biologic, for instance, in adults as well as children, as well as other therapies. So again, very heavily involved in the program. So you will hear from Sergio Sablani, Andy Bosch, Louise Fleming, Salman Siddiqui, and the rest of the adult asthma team as well. So I'm not sure if Mo has joined. I might just carry on and just give you a tiny snapshot of the research we do in allergy and asthma at Imperial. So these are the key sort of research areas, but just to say that this is very much from, say, epidemiological data as well as very clinical data, very basic science data, and sort of putting it all together with a strong focus on data science as well and translational science. So key areas, understanding the mechanisms of immune tolerance. And if Mo was here, I will tell you all about all his developments and discoveries in mechanisms and biomarkers of immunotherapy and new approaches to immunotherapy. So that's immunotherapy for inhalant allergens as well as food immunotherapy, mechanisms of anaphylaxis, mechanisms of FBIs, looking into diagnostic tests, predictive tests, and risk stratification of patients, endotype discovery and diagnostics, particularly in asthma as well as food allergy, primary prevention of allergic diseases, food allergy, atopic dermatitis, and evidence synthesis in those areas, environmental control interventions, as well as allergen immunotherapy, as I said. And these are kind of different groups at Imperial. You might recognize some places. So one is immunotherapy with Professor Steve Down, who's done, huge contributions over the last few decades, and more Samji there. Guys Cudding, food allergies, you see Professor Paul Tana, Dr. Boyle, myself, Dr. Nandini Patel, Dr. Claudia Go, Dr. Isabel Stupala, eczema primary prevention, Dr. Go, as well as Reiki Sanako there, and then Adnan's team on data science, bioinformatics, biostatistics with Sarah Fontanella and other colleagues, epidemiology, and then asthma, the big sort of asthma group at NHLI, with Sergio Saglani, Professor Bosch, and Professor Fleming very heavily involved in the program. So I believe that's all from me. I have a couple of questions that we got beforehand, but I'm going to leave that to the end, if that's okay, when we move on to the questions bit. So, yeah, lovely. Thanks for listening. And I'm going to hand over to Nina, one of our lovely students, who's going to give us sort of a little sort of overview of her experience with us.
Great. Thank you, Marta. I will start sharing my screen. So hello, everyone. My name is Nina, as Marta already lovely introduced me. I'm a pediatric allergy consultant from Germany, and this is quite new for me to say because I did all my specialization actually in Switzerland and just started a new position in Germany. I finished my MSc in Allergy in 2023, and I'm really happy to share some of my experiences today with you. And Marta, it was already lovely to see an overview of that program again, and all these pictures brings back nice memories. So I will be addressing some questions, and I will jump right into it. So what did I like most about the course? It's definitely the point, learning directly from leading experts, as Marta was just pointing it out. Some of you may have already joined some allergy conferences or will do so in the near future. And you will see that many of the speakers there will be also part of your program. So you can really see the high quality of that course. So the content is highly relevant to my daily practice. It was and still is. It's a great support, or you will get a great support throughout the course and the expertise of the teaching staff. The networking with peers from diverse backgrounds is so great, and we're still in contact and help each other out sometimes with tricky cases. So it was really worth it getting to know all these people. It's a great community. And just the combination of scientific knowledge and up-to-date research and the real-world clinical practice is amazing and very, very helpful. So how did the course help me progress in my career? So if you sign up for an MSc in Allergy, it is an excellent choice for anyone looking to advance their career. You will get specialist knowledge and skills, as just Marta pointed out in the program. And this just demonstrates this clear commitment to the specialty, and it helped me and can help you maybe to stand out in competitive applications for specialist trainings. And it's key for those aiming, for example, for consultant posts or specialist roles or an academic position, or maybe opening up your own business. Some of us did that, and I will hopefully do that too. And it's highly regarded and respected both locally and internationally, having an MSc from Imperial. And also maybe if you're interested in research, you will conduct your research project, and they really help you to conduct it, but also with a literature search and writing a thesis. Maybe some of you are already familiar with that, but it was really helpful for me, and maybe some of you are aiming for an academic or tertiary role. So how did I find the teaching delivery online versus on campus? So for me, it was a bit different because we started during during COVID times, but basically it is the same. So the online delivery, mainly also the asynchronous material, allowed me to engage with lectures, case studies at my own pace. It was very helpful having this alongside clinical commitments. And the materials were clear and accessible, and it gives you a huge flexibility. You can access course material and participate at any time and from any location. So maybe you get stuck at work and you can still log in. So that was quite helpful and amazing. And for example, when assignments are coming up, you can revisit lectures or resources as needed. That was something that I found really helpful. And then, of course, the on-campus training. That was a great time for us during COVID to finally meet each other and not to see each other only in front of the camera. But it was also a great opportunity for us for hands-on learning, direct interaction with the faculty, and as I said, with the other students. And it's also real-time case discussions. Some of you maybe not feel so comfortable discussing cases in front of a camera, more when you're face to face, and it makes it just more comprehensive when you're in a room with each other. And the balance, how did I find the balance of studying while you're working? And of course, you have family or personal commitments. So it is challenging, but it is manageable. So make sure work knows that you do this MSc, and maybe they are supportive. And it was in my case the case, but also the support from family is crucial. You need a good time management, but you can plan in advance, as Marta was just showing. So you have these different blocks, and I, for example, took leave, but maybe your work has another opportunity for you. So you need to careful plan in advance, or maybe work allows you to shift, to swap some shifts. So you definitely can maintain a balance between study, work, and family. So what were the academics like? As I already mentioned, I found them highly relevant to my clinical practice. It was up-to-date insights. It was well-structured, and a great combination of basic knowledge, but also practical use. Especially, I remember I think it was the first block with immunology. I think we were all a bit struggling, but it is still so very helpful, although we were struggling. The lectures and sessions were delivered by experts in the field, as I was just mentioning it. The assessments were challenging, but they were fair, and you had enough time. And the whole environment was very supportive and very structured. You really felt connected to the faculty, and it was a good and regular communication with instructors. So what kind of students were on the course? So with various backgrounds, Marta was also pointing it just out. In our cohort, it was mainly pediatricians, but also GPs, nurses, scientists, so various backgrounds, as I was just saying it. And from all over the world, we had people from Singapore, Croatia, UK, Ireland, me from Switzerland, and from Kenya. And it was a very supportive community. As I was saying, we were still in contact, sometimes meeting at conferences or checking before it if we could see each other there, or we are asking via chat groups when tricky cases are coming up. So would I recommend this course? Of course, I will recommend this. I highly recommend this course. I feel much more confident in my clinical practice. It definitely deepened my understanding of allergy and its management, and it opened new career opportunities for me, including specialist roles. And also this program enabled me to contribute to published studies. So thank you so much for listening, and I'm happy to take on questions later on.
Thanks so much, Nina. That was really, really nice. Really nice to hear all these positive feedback. Thanks so much. So Hannah, I think I'm gonna be sharing slides for you. Yeah. Let me just put your slides up. I'm gonna mute myself, hopefully. And yeah, over to you, Hannah.
Thanks, Marta. So thank you very much for inviting me to talk about the course. So I'm Dr. Hannah Peters, and I'm a GP in London, very close to Imperial, and also have a special interest in allergy. And I've just almost come to the end of my first year doing the postgraduate certificate, and I've really enjoyed it. So next slide, please, Marta. Just go through my highlights. So I think for me, I've come from quite a strong clinical background, doing lots of clinical work as a GP, actually already doing an allergy clinic. And what I've loved about the course so far is it's given me a much stronger grounding in the scientific basis of allergy, which I think was kind of lacking before I started the course. And term one, it's a bit of a shock to the system when you start it, but it's really rewarding once you've completed it. Really understanding immunology, really getting a proper grasp of the scientific basis. And then I've also really enjoyed the third term, which is the cutting edge of allergy, because it basically starts getting you thinking about research and understanding how to critique journals and publications, and not really to accept everything that you're being presented as face value. So thinking about where's this literature coming from, who's writing it. Robert Boyle, who's one of the lecturers, gave a really, really good talk on that, which I think we all found really enjoyable. And then lastly, I think the other major highlight for me has been meeting other doctors interested in allergy. So I think particularly as a GP, you sometimes are quite isolated working in your own clinical environment. and the course really allows you to meet a whole variety of other people, paediatricians, GPs, specialist nurses, who all have a real genuine interest in allergy, which I think, like Nina was saying, that will be the relationships you forge on the course will be much longer lasting after the course is finished. Next slide, please, Marta. And so in terms of career development, I think it really strongly develops career development, particularly from a GP perspective. The BSACI, the British Society of Allergy and Clinical Immunology, has recently developed a framework for GPs to become accredited as basically a GP with a special interest. And part of that accreditation, they've recognised that either the PG Cert, the diploma, or the MSc is really desirable to have as part of that application process. So I think if you're a GP thinking about wanting to develop your interest in allergy, maybe set up your own clinic, do private work, it would be incredibly helpful to have this on your CV to do that. And I think then, so that's kind of at a kind of CV face value level. I think from a clinical perspective, it really has changed my day-to-day practice. So I feel a lot more confident talking to patients about you know, latest information we have about allergy, even simple things like EpiPen technique when you do the practical sessions in term 2. It really just gets you up to date with the latest guidelines, and you feel a lot more confident in your clinical practice. And then lastly, allows you to meet lots of leading experts at Imperial. Like Marta was saying, you know, it's the top university, it's a world leader, and it allows you to forge relationships with them, which is again is incredibly important. Next slide, please, Marta. And so the way the course is organised as this hybrid online campus learning is really, really helpful if you've got other commitments. I think most people doing the course will have busy jobs, often have family commitments. And as Nina was saying, it really allows you to structure learning around your own pace. So you can watch the lectures in the evenings, at weekends, you can rewatch the lectures to cement your learning. And then it's mixed with a nice combination of campus days, just enough that you can maybe take study leave for those. And the great thing about the campus days is you actually get to meet the other students face to face, meet the academics, and that really does have a different dynamic actually meeting face to face, which I've loved the campus days. I think they're great, but doing that hybrid combination allows you to structure it around a busy job. Next slide, please. So in terms of time commitment, I just put this up as just a rough gauge. It's not absolute. I think it waxes and wanes as the terms go along, but approximately you probably need to allocate about a day or a day and a half a week. That doesn't mean it has to be a set working day. You could work around, you know, doing the lectures at other times. I think at times it is really hard work. That's just, you know, there's no denying that, but equally it's incredibly rewarding. So I think if you're getting to the stage of wanting to do this course, you've got a genuine passion about allergy, you're doing it because you want, it's your own motivation, and it's just so nice going back to learning again after being a clinician and just doing more service provision for a long time. So I've really loved learning again. And you can balance it. I've got a young family. I work, you know, 4 full days a week, and I've managed to balance it with doing that. Next slide, please, Marta. So I think in terms of what the academics are like, I think they're brilliant. Such a diverse range of personalities, and also really complementary personalities. So I think the key thing is they're all genuinely really interested in teaching, and they have very dynamic, engaging teaching styles. You've got people like Professor Paul Turner, Robert Boyle, you've got Prof Durham, and they're all kind of world leaders in their areas of expertise. And so I think you get something different from each of the academics, which is incredibly helpful in terms of developing your learning. So yeah, they've been a really great community of academics. Next slide, please. So who studies the course? Again, this is very similar to what Nina said, but it's a diverse group of professionals. There's paediatricians, a big pediatric component, lots of GPs, some specialist nurses, dietitians, and some kind of biomedical scientists. And they're from all over the world, which also is quite nice because you get to learn about different healthcare systems, how different areas of the world are affected differently by allergy. But as well as having that, for example, in my group, I had some very much local students who work nearby to where I work, which is also very nice as well. Next slide, please. So would I recommend the course? Yeah, absolutely, 100% without reservation. I think Marta's here, but she's been absolutely amazing as the course director. Really passionate about teaching, really approachable. I think they want you to get the most out of the course, so you can email with questions, you can directly email all of these great leading experts about anything you're wanting to develop. If you're interested in research, I think there's loads of opportunities. So I think, yes, going into it, you have to be prepared to do some hard work, but equally it's incredibly rewarding in that process, and you get to develop new friendships along the way, and I'm sure it will help with professional and career development by doing it. So yeah, I strongly recommend doing it. Thanks, Marta.
Lovely. Thanks so much. I'm kind of humbled by all these super kind words. Thanks so much. And honestly, I think, we're so lucky. I always say to my colleagues, we're so lucky. We have fantastic students, really much motivated students. And, sometimes people, when you think Imperial, they think, oh, sounds a bit overwhelming. It's going to be really competitive, really stressful. Of course, as you all have highlighted, it's hard work, it's demanding. But I don't think that comes from kind of competition or a sort of a tricky atmosphere in terms of, that. I think, it's a really nice community. The students, they really support each other, and it's very friendly. And we try and, nurture that environment of, openness and just friendly and approachable and stuff. And I think that's where we all feel more comfortable. So I think we're very lucky we have fantastic students. Great, lovely. So I think we're going to move on to the questions. I saw a question in the chat that I'm going to address first, and then the questions we got before this. So someone is asking in the chat, how many lessons per week do you have roughly? So I think, if you're asking specifically about the live teaching, so it's not that every week you will have live teaching. So again, so we'll say the first year you're going to have 3 modules, and each module has a similar structure. So we launch the module, we do a webinar, 30 minutes, and then you do your own bits. And then about 2 weeks later, you have a half day, which is say 4 or 5 hours in an afternoon of live teaching. And you have that half day of teaching probably 4 or 5 times in the module, okay? 4 times, say, plus the hybrid days. So it's, you have a good chunk of live teaching, but it's generally once a week. Okay, the hybrid days can be 2 consecutive days, and that usually for the online stream falls more in the morning, UK time. Okay, but it's kind of, you have several sort of consecutive weeks of live teaching. So that's the live teaching side of things. So generally towards end of June, we have the date for the whole academic year, provisional dates, and we circulate that to people who have an offer to join the course, so you can plan in advance. And then when we do the launch webinar for each module, we release the final timetable for the module with all the little times and sessions and all the detail there. Okay, but as Hannah was saying, on top of the live teaching, you have quite a lot of materials to go through for your learning. You have your assessments, etc. And I think Hannah's estimation is very accurate, because at the end of the day, we are a part-time course, and it's 30 credits per year, which is the equivalent to, say, a third of a full-time program or a full-time, say, job, as it were. So I think it's very much 1.5 days on average, and you can structure that as you like. Okay, but we'll be circulating dates soon. So someone asking, can the live sessions be attended later? So if the question is, can I not attend and just watch retrospectively? The short answer is no. You have to attend the live teaching. And this is very much because, it's not that you're going to be given a lecture and that's it. Okay. You're there for interaction. So you're there to ask questions. You might be presenting the work that you and your group have done. So you need to be there. Okay. Of course, everything gets recorded. So on top of attending, you can watch retrospectively as well. But it's not, I'm going to watch retrospectively and not turn up. Okay, so that needs to be very clear. Okay, so you don't get in trouble later on. Okay, so I'm just going to move on to the other questions we had received. I'm probably not going to share screen for that, just in the interest of time. So, one question is, quite a few of that so has been probably sort of addressed already. So someone asking part-time courses, please, for mums on mat leave and cannot attend physically as caring for the baby. So I guess the question is that suitable for me? So short answer, yes. As Hannah was saying, the vast majority of our students have busy lives, either work full-time or nearly full-time. And, as I said, mature students with often young families, etc. And it's all about time management and whether you have that extra time to allocate to this. If you think you cannot fit anything else in your life, then probably not a good plan, to join. But if you think you can fit that extra day in here and there, and you have the motivation, absolutely. So we've definitely had people on mat leave joining or going on mat leave. And it's generally been a really nice time for them to be in touch with some colleagues and be in touch, keep their brain active during mat leave. I've been on mat leave a couple of times. I know how it feels like to be completely in a different planet, right? So that's one question. So second question is this course relevant for a GP who wants to develop special interest in allergy and immunology? So I'm not going to answer that. I think Hannah has answered that. So absolutely. I think GPs are in such a privileged position because you see all ages, and allergy, applies to all ages. And you are all organs. So, allergy is multi-system. So you're in a very good place to make a big difference. And allergy is such a common disease, is so much of a community disease that we need more people in primary care, managing allergy better and getting all the basics right and spreading the word out in the community and in their working environment. So absolutely welcome GPs, to join the course. Interesting question we got here. Is there any age restriction for admission to courses in the college? So age restriction as in upper limit, there's no restriction, absolutely not. And I think, nobody's too old, to learn more. I think we all want to learn all the time. And then in terms of lower age limit, I mean, this is a postgraduate course, so you have to have completed some undergraduate degree to be able to qualify. So I don't think kind of under 18, will apply because you need that sort of undergraduate degree already, but we got that question. And then the last question we got beforehand is, will my trust be able to fund my studies at Imperial? And if so, what's the process for applying or arranging the funding? So through the university. So short answer to the question, like if your trust can fund your studies, they absolutely can. And lucky you if you manage, that's fantastic. Okay. The specific admin process, probably that's better to kind of clarify 100%, directly via an email. But my colleague Tamsin is very familiar with that, and there's a bit on the website where you find all the specifics about it. But basically, your trust needs to sort of submit a letter or a statement, stating that they're supporting you, etc. So, and so basically, you meet your deadlines for deposit, etc., either through your trust or directly, and then your trust will refund you, etc. So, but yeah, I mean, we've seen that many times with students, and you have issues individually, so you reach out to us, and Tamsin will help. So these are the pre-meeting questions. So I'm just going through the chat to see if I've missed any questions. Is this master's too advanced for an ST2 going up to ST3? I will say no. I wouldn't say too advanced. I mean, again, and people come from very different backgrounds. Some people don't have a healthcare background. Other people, have a very clinical background, and immunology sounds like very far, or research techniques, etc., sounds very far. So everybody comes from a different background. So we've had many junior trainees. We had, ST2s, ST3s, absolutely. I think, it's a very good time in your career to do it because you already have some clinical background, so you can put the clinical aspects into perspective. And I guess if you do it early on in your career, that kind of opens up options relatively early on, say, to go into specialty training. So we've had quite a few students who've gone into, say, if they're pediatric trainees, they've gone into Greek training in pediatric allergies, or specialist training, or special interest or spin in allergy, epidemiology, or we've had students who've gone into allergy specialty, I say more adult physician. So kind of can help you getting these very precious posts in some countries like in the UK. Or, you know, you might see you want to do PhD and take some time off your clinical training and do MD or PhD. So we've had students there. So I think it, you know, like will help you establish yourself as an allergy person early on in your career, that if this is the path you want to do, more of a specialist tertiary role, or, you know, people are going more private practice sometimes as well, you know, that sort of, if it happens early on, you know, you have more control over the rest of your training. We have quite a few people who join more in SD7, SD8, and they, you know, feel like, oh, I've missed doing great doing spin, etc. Or people in the sort of early consultant years as well. So again, you know, I think it sort of makes a difference. Everybody feels, you know, it's made a difference. But definitely, I wouldn't say you as a junior trainee, you know, you are at disadvantage. And, you know, like, you know, some people in the group might look after you well because you're kind of a young person there and stuff. So I've seen some kind of nice dynamics there as well in the groups. Just going through the chat quickly. How long are the live sessions? So again, you will get the time, you know, you get bit of an idea when we circulate the dates. So half days are usually 4 or 5 hours long with some breaks, and it's usually afternoon UK time. Hybrid days are roughly the same length, but more morning time. Okay. Going up in chat. When is the deadline for application? So yeah, so I mentioned that in my slide. So overseas online end of August, overseas blended end of July, but apply as soon as you can because the whole application filling in, etc., takes quite a bit of time. Home students, that's UK and Ireland, regardless of the stream, is end of August. Okay. So someone asking, I will be away for 2 weeks in November. Will that be an issue? So you need to look at the specific calendar. And, you know, if there is live teaching at that time, you know, you should be joining the teaching. So making arrangements for that. So you kind of mitigating circumstances, you know, some people have had, you know, operations on that day of things that are, you know, absolutely cannot control. So that, you know, regulations in the college to factor that in. But say a planned holiday wouldn't qualify as that. So you kind of have to work around the timetable. Okay. I think I've gone through the questions. I'm just going to check down. Someone saying hybrid sessions. Did you say it was 3 days in 1 year? So hybrid sessions is 3 times in the year. So first, if you think about the first year, is 1 day in module 1, 1 day in module 2, and 2 consecutive days in module 3. Okay, so in paper is 4 days, but you count 3 times. Generally, people stay overnight if they don't live, you know, in London. If it is 2 consecutive days. Great, lovely. Any final comments? Anyone would you like to add anything, Hannah or Nina or Tamsin?
I think you've covered it from my end.
Right, and just get in touch if you have any questions. Tamsin is super responsive and has all the relevant links and all the relevant information. It's super helpful. Lovely. Okay, so there are no other questions or comments. How many live sessions are in a term again? Okay, so how many live sessions? So you have launch webinar, and then you generally have, you know, it depends on the module. It's not exactly the same for every module, but you will have, say, 3 pure online afternoons. That is, everybody's online, and then you have the hybrid day or days. So it's something between, say, 4 or 5 days in total, generally, but again, it can change slightly module by module. Okay, that's that. Okay, great. I hope that was helpful. So yeah, feel free to approach us. Tamsin has just put the program email in the chat. Get in touch if you have any questions. And when you apply, I interview all the candidates coming to the program. So there's a nice opportunity to meet one-to-one and ask any specific questions and things. Okay, so yeah, looking forward to seeing some applications coming through from you guys and meeting you at the interview. Okay, Thanks so much, everyone, and big thank you to Hannah and Nina and Tamsin for being there and helping organize this. Okay, thanks so much.